I'm raising with you the question of testing and tracing. This is the strategy on which everything else is based, and there's an enormous national effort being put in based on the premise that the strategy of test and trace would actually operate, and it hasn't operated anything like at the scale that is required. Look, we've been told that the target figure for capacity should be 15,000 a day. That's 105,000 a week. We're currently testing less than 42,000 a week. So there's a huge gap to be made up there. And I think people are getting very frustrated, really. You know, people are making enormous sacrifices. They're doing everything they're told, and yet the state isn't delivering on its side of the bargain. And, you know, frustration is growing, understandably, because of that. And really, this needs to be dealt with as a matter of urgency. Look, the public, as I say, are putting in an enormous effort. And we know now, according to NEFIT, that the target, unless the target is reached, we cannot start to unwind the restrictions. That's the first thing about test and trace. The second thing is, what are the current numbers that are being traced? Can you provide detail on that? We haven't had any detail on that whatsoever. So can you tell us now about that? Thirdly, in relation to nursing homes. You know, there's a population of about 60,000 between staff and residents in nursing homes. I think you used a figure of 28,000 there earlier on that have been tested. When are the others going to be tested? And can you give us a target date for completing that testing? So, you know, there are my questions just in relation to testing. Do you accept that we can't start lifting restrictions until you have the full capacity in place? And when exactly is that going to happen? And when are you going to complete the nursing home testing? And what's the current level of contact tracing?
Thanks so much, Shortall. Public pathway is a huge effort. The HSE has as well. I've watched them move mountains to try and robustly put in place a testing process from nothing, from something that didn't exist, something we didn't test for. I think they've done a very good job. And we all share the frustration that we want to be further on than we are, absolutely. But when you look at the international comparisons and you look at the number of countries that are lifting restrictions who've done less tests than we have. I mean, we rank, according to our World in Data website, 4th highest in the European Union out of 22 EU and UK countries in terms of the number of tests completed per million population. And there are many countries lifting restrictions who are doing fewer tests than us. So I don't accept the premise that restrictions can't be lifted on the 5th of May because of testing. And it doesn't really, you know, well, my word is one thing, but the CMO wouldn't either. The CMO made it very clear that the reason restrictions, he doesn't believe he'll be in a position to advise the lifting at the moment, is the behaviour of the virus. But you are entirely correct. Testing is a key component. It's one of the key, I don't dispute that at all. And we do need to get to having the capacity to test 100,000 a week or thereabouts, 15,000 a day. And the HSE have, and I hope you got our briefing note this morning, the HSE have given a roadmap as to how they intend to get there. It is agreed with the Department of Health to have end-to-end capacity of 10,000 tests a day this week, the week we're in, starting Monday the 27th of April, to move to an ability to have 12,000 tests a day from Tuesday the 5th of May, and to have an ability to do 15,000 tests from Monday the 18th of May. I do make the point that doesn't mean you'll be doing that many tests that day. It does depend on the case definition and a variety of other things, but to have that capacity in place. They've also, and I hope this is in the note you got, they've also given the swab to result times and the end-to-end turnaround times as well. So yes, we've hit bumps in the road in this, there's no doubt about it, but I think we do now have an agreed trajectory to get to 15,000 tests a day by the 3rd week of May, and I think that is good news. It will absolutely be required, and the HSE need to continue to update on that, and they will. Testing in nursing homes, my understanding from conversations with the HSE is they expected to complete that this week. So that was the expectation, that to complete that this week. You know, they were starting with nursing homes with outbreaks, moving to nursing homes with a case and testing everybody there, and then moving to test at least staff in all other nursing homes and patients, residents, my apologies, where clinically appropriate. I am trying to check if I have the answer in relation to contact tracing here, and I can, if you don't mind, I'll send it to you in the interest of time. Thank you.
Minister, you speak about the behaviour of the virus, you know, and this is, Tony Holland has raised this as well. We can only know about the behaviour of the virus if there's a proper test and tracing system. So look, as I said to the Taoiseach this morning, that's a circular argument. You know, we need to get down the numbers of people in hospitals and the numbers of people in ICU in particular. But we'll only succeed in doing that if we can tackle the virus at community level. And we're failing to do that at the moment because of the absence of sufficient testing. And, you know, we've flattened the curve, that's great. We've reduced the transmission figure. But that's largely due to the fact that people are locked down. Do you know, so to lift the lockdown, we have to have that system in place. And again, I would say you need to honour your part of the deal in that regard. My next question relates to staffing. And there's clearly big problems, certainly in nursing homes. You were talking about this earlier on. There's 460 nursing homes. That scheme with the HSE has brought just over 200. That's one staff member to every 2 nursing homes. When you actually look at the number of nurses involved, there's only 85 nurses. You know, and nursing homes desperately need nurses. Of course, they should be required to have more nurses. And, you know, it'd be interesting to see what HICWA has recommended in this regard. But there are only 85 nurses on that scheme, which is 1 nurse to every 5 nursing homes. Now, that's wholly inadequate. And I'd like to ask you what steps you are taking to improve that figure. I also want to ask you, though, in relation to trainee nurses. A nurse who are due to graduate this year. There was a proposal put to you that it would be possible to bring on stream about 500 nurses if you were prepared to agree the early graduation of those nurses. An 8-week early graduation for those nurses, and you would have a huge influx of nurses. You've done this with medical students and medical graduates. You've done it with Gardaí. Why will you not do it with nurses? I also want to add my voice to that appeal to you to please give a direction to pay the money due to nurses, particularly HSE nurses, and in Cork, in Limerick and in the Sálta group. You know, it's no good patting people on the back. They should be paid the rate for the job, and they're not getting it at the moment. The other area in relation to staffing, which is a huge problem, and that is the whole question of childcare. Minister, would you ever get together with other ministers in Cabinet and sort this out? There's a huge number of healthcare staff and now other public servants who are partners of healthcare staff who are out of the workforce because of the failure to make provision for childcare. It's a shambles at the moment, and it needs to be dealt with. And the last area I want to raise with you, Minister, is the whole question of mental health. All of the indications are that people who have existing mental health problems are in severe difficulty. And there's a whole range of new mental health problems that are emerging now as a result of COVID. Anxiety, depression, fear. This is particularly the case in relation to young people. Recent surveys showed that over 50% of young people are complaining about these conditions as a result of where we are at the moment. There is a need for a very significant mental health response from government in relation to that. And I want to ask you, have you had any engagement with mental health reform? And if not, will you arrange that so that there can be a current mental health response to the current problems? And I'm talking about things like ensuring that counsellors are regarded as essential service providers, that arrangements be made for one-to-one counselling to take place at a safe social distance, obviously. But that needs to happen very quickly. We also need, of course, a clear framework now in place to take us through from now until, the coming months and possibly years to deal with the considerable overhang of mental health difficulties which are arising as a result of this pandemic. And in that regard, I would ask you to give a commitment to publish the review of a vision for change and to commit to funding it.
Yeah, I must check where the review is, because I know it was ready to go to Cabinet, so I'd like to get that. It was completed and it was due to go to Cabinet. Whether it's appropriate to bring it now or for a new government, I think it would be appropriate to bring it now. But let me check that and come back. I will meet with mental health reform before we next meet, and I'm meeting Jigsaw, I think on Thursday, but I'm scheduled to meet Jigsaw as well. Look, on childcare, in the time available to me, we have an in-reach childcare proposal. I'm hoping that that's something in this roadmap that's published tomorrow that can be prioritised at the appropriate time, so we can get in with actually providing childcare in the first instance for healthcare workers and then for other professionals. On the enhanced nurse contract, I gave the figures: 700 in February signed up, now 3,400. I've been very clear to the HSE, and I will consider issuing a directive, but we've been clear that I want that to increase. On the training nurse, on the allowing nurses graduate earlier, I might just give you 10 seconds on this. And this was something I was very sympathetic to, except I looked at the working group that had been set up that had student nurses on it, had the colleges on it, had the NMBI on it, and on balance it came down against it. I'll share it with you, and I'm happy to engage with you offline.